Hi, my name is Cuerrier-Downey, and today we're going to be talking about eating disorders during adolescence. So, first and foremost, we're just going to talk about what is an eating disorder. So, according to the American Psychiatric Association, eating disorders are behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associating distressing thoughts and emotions. So it is a mental condition and it can have a very big effect on someone's both mental and physical state. Um, Sometimes it can actually lead to death, depending on how severe the eating disorder is. Um, it's something that is still very much in our society today, especially with how social media is nowadays. It's something that's very much there. And it's something that we can't brush aside. We have to keep talking about it because it is a very big mental condition that people do live and suffer with. Now we're going to talk about the signs and symptoms of an eating disorder. Now, there are many more than what are on this page, but these were the few big ones that I saw that really caught my eye and that I feel are the most prominent that you'll usually see. So, the first one is mood swings. Usually, when someone has an eating disorder, and I mean, this could also be for a normal person, we all have mood swings, but a lot of people with eating disorders have extreme mood swings. So they'll be all good one day, and if you say like something that can trigger them, they'll flip the switch and they'll be angry all of a sudden. So it's one of the things. The next one is fatigue. So because your body is not getting the nutrients that it needs, and this is more so relating to anorexia, if your body's not getting the nutrients that it needs, then you can start to feel very fatigued because as we know, our brain needs sugar. So if you're not providing your body with some form of sugar, your brain will just not function properly, and that can actually get you to be fatigued. Um, Fainting or dizziness. So this is sort of correlating with the fatigue because you're not getting your body the nutrients, minerals that it needs. Your body is going to be weak. And that can relate to fainting or dizziness because you don't have the muscle support to raise you up. And like I said, an eating disorder is both a mental and physical condition, but it's more so mental. And the next one is hair loss and thinning hair. So a lot of people, it's the same thing like when you're pregnant, you go from having a little bigger of a stomach to no stomach. And that can cause you to lose hair or have your hair thin. Same thing with an eating disorder. If you are someone who is a little bit more on the bigger side and you drastically lose the weight, it can involve in thinning hair and hair loss. Then we have unexplained weight change. So if you see someone and next thing you know, 2 months later, their weight is drastically different, that can be a sign. Especially if you know that they usually don't go to the gym or do anything like any physical activity to help them out. That could be a sign. Another one is forced vomiting. And this one you'll see more when it comes to bulimia patients. But it's when it's most of the time when you're eating like dinners and stuff like that. And then after dinner, you feel so guilty of that you ate that. So you rush to the bathroom and you force yourself to vomit because you have that guilt in you that you're like, I can't have this in my body. The next one is hiding food. So you feel guilty about eating the food, so you'll go either in your room most of the time and you'll hide it either under your pillow, under your covers, under your bed, in your closet, or in your cupboards because you feel ashamed that you're eating this specific food. And then we have withdrawing from social activities. So if you have, especially if you're a friend who is like always at social gatherings, always talking to people, and then all of a sudden they flip a switch and they sort of withdraw themselves, push themselves away from social activities, that could be a warning sign. So now we're going to go through the different types of eating disorders. So we have the most common one is anorexia. So anorexia is basically you're starving yourself. You're not giving your body the nutrients and the food that it needs. And your body ends up being at the lower weight of what you should be because as we know there's a chart Whatever height you are is whatever weight you should be. They'll be on the low, but very, like very, very low of that spectrum. That can be a little concern. And anorexia has the highest mortality of any psychiatric diagnosis other than opioids. Then we have bulimia. So bulimia, you're alternating between low weight calorie diet and like a high calorie diet. So basically, you'll eat very good. You'll eat low calorie foods, and then you'll have like a purge where you'll binge on the high calorie foods. And this is the one where there's the forced vomiting because you feel bad about what you did, so you just force it out. Then we have binge eating. So binge eating, you're basically eating large amounts of food and you can't control. You don't have any control over what you're doing because, like I said again, it is a very serious mental condition. You don't have any. You feel you lose the control over your eating. Then we have specified feeding and eating disorder. Now, this one, it doesn't have enough that it meets any of the criterias. So you can't, it's not like it doesn't fit in anything. So it has to be its own um, genre, but it is a person that has a serious eating problem, but there's not enough about it that you can't put it somewhere in any of the criterias. Then you have avoid restrictive food intake disorder, as well, also known as AFRID, ARFID, I mean. Basically, this one, you fail to meet the nutritional needs, and it's usually like extremely picky eaters, and it can also be a very sensitive thing. So you might see this more when it comes to people with autism, because sensory is a very big thing. Then you have pica. Pica is basically you're eating something that is not remotely food. It doesn't have any nutritional value. This can include, in my examples, I have paper, paint, metal, chalk, and a lot of parents will usually try to find alternatives for that so that they're still eating something that has some sort of nutritional value, but it still has that same texture as chalk would or paint would. And then you have rumination disorder. So this is when someone does reverse swallowing. So they swallow, they bring it back up to re-chew their food and then re-swallow it. So, eating disorder prevalence. So, according to McCarthy 2022, eating disorders are very common, and 1 in 7 men, which is about 14.3%, experience eating disorders, and as well as 1 in 5 women, which is about 20%, experiencing eating disorders by the age of 40. And in those 95, usually they'll start before the age of 25. So usually an eating disorder will always begin before the age of 25, which is why it is very common and high in adolescence. Now we're going to go through with my first peer-reviewed article. So I found this article. It's Adolescents Eating Disorder, Early Identification and Management in Primary Care. So basically, this talks about more about why eating disorders appear more in adolescence. So this, according to Chu and Temple's 2022, the adolescent population is at an increased risk of developing eating disorders because the developmental changes affecting their perception. Basically, what this means is that at this stage in your life, your body is going through many different things. It's going through physical changes, it's going through psychological changes, it's going through emotional changes. I mean, you're hitting puberty, it's getting to that time. So when we look at ourselves in the mirror, we might see ourselves and we might not think that we're good enough. I know I personally went through something like that. That alone can make them at a very high risk for developing an eating disorder. So it's all about, so that's the thing. Going through puberty, your body can change and your body will, your body changes. You're going through puberty, you're going through all these things. And especially in women, that can have a very high factor as to why a lot of women have eating disorders. So what increases the risk of developing an eating disorder? Low self-esteem. If you're someone that has low self-esteem, that increases your risk of getting an eating disorder because you don't like the way you look, you feel bad about yourself, you put yourself down, so you want to change. But then when you change, you don't necessarily take the right approach for it. Perfectionism, and this could be perfectionism that you have on yourself or perfectionism that your family has on you. You want to be this perfect person, this perfect weight, the perfect height, and everything, so you'll do what it takes. Impulsivity. This could be that sometimes, especially at this time of age, we make impulsive decisions, doing things that are that do develop eating disorders could be related to that, because you're impulsive. If you're like, I'll do this, then basically you want to do it, and it's just like it's impulsive. You're not thinking straight. Then body image dissatisfaction. This is basically you don't like your body. You're dissatisfied with it. You don't like the way it looks. So you want to change it. But sometimes but the way that you change it, it might not be the correct way. You're not going to do, exercise. And when I mean a diet, and you want a diet, but you have to do a diet that's appropriate and that is safe. Um, you'll do anything just to get rid of the dissatisfaction that you have on your body. Now, treatment and prevention. Most eating disorders can be treated when you're at home. So this is like outpatient when you're at home. But there are some, if it is medically and psychological, are they if they're medically or psychologically unstable, they have to be admitted, because the number one thing is safety for them. They want the safety of their patient. Every eating disorder is going to have its own different treatment plan, because every eating disorder is different. None of them are the same. They might correlate and they might, you know, mix in with each other, but they're different. So, according to Hay, 2020, as cited in Chu and Temple's 2022, it stated that there were the main treatments for eating disorders are FBT, which is family based therapy, and CBT, which is cognitive behavioral therapy. So, they will usually give the treatment that aligns with that patient's diagnosis. So, for FBT, it's more so with patients who have AN and BN, which is anorexia and bulimia, while CBT is more so for patients who have BN and BED. So, considering how bad your bulimia is, you could either get the family based therapy or you could get the cognitive behavioral therapy. So, now we're going to go through my second article that I found, which is Eating Disorders in Adolescence Social Causes and Consequences. So, now we're going to talk about more about the social factor. So, in this article, they described eating disorder being a cube. And I really liked what they said about this. So, I'm just going to read this little part. According to Totova, 2019, eating disorders can be seen as a cube. Each side of the cube is a different risk factor that is involved in increasing the risk of an eating disorder as well as the effect of an eating disorder. So, basically, if you look at a cube, there are many different sides. You can't just look at someone with an eating disorder and just see one side, because that doesn't cover the whole reason as to why they have an eating disorder. There's many different factors. There's biological factors, there's environmental factors, there's social factors, there's cultural factors. There's all these different types of factors that do influence a person to have an eating disorder. And looking at it as a cube, it will make you see the bigger picture instead of just the blank page. There are many social factors that are affecting the emergence of EDs. So you have media pressure, you have ideal standards of beauty. As we all know, the standards of beauty for a lot of them is slim and thin, which brings me to my next one. Slimness doesn't equal health. You could see someone that's very thin, that doesn't mean that they're healthy. And you could see someone that's very overweight, but that doesn't mean that they're not healthy. Specific food requirements. Some people have, unfortunately, some type of medical condition that has them not eating everything that they should be eating. Obesity not tolerated by society, excessive focus on physical appearance, competition among peers, and obesity and subsequent diets caused by incorrect eating habits. Now we're going to move on more so to the impact on social development. So this can have an impact on your self-esteem. You're disgusted with your own body. You start to feel like disgust, shame, and inferiority and guilt because you did this to your body. Peer relationships. Social relationships are disrupted. They avoid social contact. They lose friends. They isolate themselves. The romantic relationships begin to have problems. Social isolation and long-term effects on social functions. They're losing interest in school and work. They're not able to concentrate because they're not getting all of the nutrients that their body needs. And they're abandoning their friends or activities with friends because they don't want to be around. They'd rather just be by themselves. Identity development. This can have a serious impact on their identity. There's that social disconnection because you don't know who you are at this point. And there's emotional instability. With going through puberty and going through an eating disorder, you can become emotionally unstable. So, why did this study matter? This study was really important because it shows you the bigger picture. A lot of times people don't realize that eating disorder isn't just caused by one thing. It can be caused by a multitude of different things. It can be caused by the people you hang around. It can be caused by your parents, the culture that you were brought up in. A lot of cultures, being thin and slim is the beauty standard. And if you're a part of that culture and you're not thin and slim, you can feel like a disappointment, especially if you have parents that tell you that. Um, it's really more than just looking in the mirror and not feeling good about what you see. It's a mental condition. And it's something that we need to keep spreading awareness of because with how social media is nowadays, there might be an uprising of eating disorders. And it also, like I said, this research really shows you the impact that eating disorder can have on someone's social development. To conclude my presentation, I want to just go back on some key points. So, eating disorders, they can start very early, but they will appear more in adolescence. They impact more than just your physical health. They impact your mental health, your social development, and your emotional development. There are many things that can influence an eating disorder. Remember, like a cube, there's many different sides, and an eating disorder can have severe social consequences on a person's life. And eating disorders are not just going to go away. Sometimes they can, like I said in the beginning, they can lead to death. Um, and like I've continued saying, it's something that we need to speak about and keep talking about. And then when it comes to treatment and professions, you need to look at the influence that is around that person and see what is making them do this. Thank you very much.